Hello everyone. Today's video is about which order to treat fungal colonization of the gut or the sinuses first, in which order should they be treated. I'm going to extend that to yeast overgrowth, maybe mold overgrowth as well, because it's not necessarily just about fungi. Just before jumping into the video, if you don't mind taking a quick minute to just like, share, subscribe, and or post a quick comment in the comment section, please, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. So the question was posted on one of my other videos talking about whether to treat Lyme or mold first, I believe. Good follow-up question, but a kind of a related topic. So it says, do you usually treat fungal colonization of the sinuses before the gut, or do you treat them at the same time? So thank you for the question. And as I said in the intro there, when it comes to fungal overgrowth, it gets tricky because there's really limited testing options for testing for fungi in the sinuses and the intestines. Oftentimes, we'll say intestinal testing, we're able to test for yeast, which is kind of related to fungi, related to mold, but we don't have any commercially available tests that are able to look for fungi or mold in the intestines, to my knowledge at least. There are some tests that kind of purport to do that in kind of a roundabout way, but in terms of a direct definitive test, I don't believe that's something that's commercially available. And then for the sinuses, we certainly can do sinus swabs and cultures, and we've done those in our office, or we've done them and sent them off to a lab to be analyzed, and we can find evidence of mold or yeast. But in terms of the definitive accuracy of those tests, it's if we culture it out, it's growing in there, but when we use a nasal swab to test the sinuses, we might miss the area that is being colonized. Sinuses are quite cavernous. They're not just like little tiny narrow tubes. They're quite cavernous, and so we're not going to swab every square inch of all the sinuses in there, because you can't get a swab into all of those sinuses and then be very invasive and just can't really see what you're doing in there. So long story short, they're not definitive tests. So it gets there's the possibility for false negatives and false positives to some extent. It's kind of hard to know definitively what you're treating sometimes, but just to kind of maybe make the question a little bit broader in terms of would I usually treat colonization of the sinuses before the gut or at the same time, whether it's yeast, fungus, molds, bacteria, whatever it happens to be. In terms of the order, like many things in life, it depends. It really depends on what the main symptoms are that are bothering a patient, and how sensitive they are to various things, what their detox pathways look like. In most cases, I usually start treating the intestines before the sinuses. If a patient had really notable digestive issues, really notable sinus issues, I'd probably start treating the intestines first, and then once that protocol was underway, making sure that usually I recommend starting at a lower dose of things and gradually building it up. So once the patient was at the full therapeutic dose, or maybe a week or two, as long as they were tolerating it well, then I'd probably piggyback the sinus treatment on top of that. That being said, there are other cases where a patient maybe has a history of being really sensitive to a lot of treatments for their intestinal tract, and so if they had gut issues and sinus issues, I might treat the sinuses first, just so we can try to reduce some of their symptoms, reduce some of the kind of pathological burden that's on their system, and then move to the gut after that. There's also some rationale for if we thought that it might be a mold induced or mold related intestinal issue that was going on, like say the patient did a mycotoxin test, they had elevated levels of mycophenolic acid, which is this highly immunosuppressive mold mycotoxin, and we thought, well, maybe and say the patient had pretty treatment resistant SIBO or large intestinal bacterial overgrowth or something like that. That might be a case where we want to go after what's in the sinuses to kill that off, so that the patient's not continually swallowing mycophenolic acid into their intestines and having that immunosuppressive effect. So there might be a scenario like that where we would kind of treat the sinuses first, because maybe the sinuses are exacerbating or perpetuating what's happening in the intestines. So again, it really depends on the specifics of the situation, but in many cases I'm treating both at the same time. usually starting one then the other, unless the patient's either really, really antsy to get on the full treatment protocol right away, or the patient just seems to have a really robust constitution, and they're like, oh, if they come to see me for the first time and they have, say, a chronic sinus issue, and they're like, oh yeah, I was on antibiotics for pneumonia or something like that a couple months ago, and like my gut just hasn't been the same since. Like, well, let's get you on some strong probiotic. Let's get you on maybe some antimicrobials for your gut just to be on the safe side in case there's some opportunistic yeast overgrowth or something like that. And then we would, I'd probably phase in the nasal spray pretty much at the same time, because in my practice, I'm very used to treating folks who have complex chronic illness, very sensitive people in many cases, like, sensitive to medications and supplements and whatnot. So I'm used to kind of doing things a bit more methodically so we don't cause big flare-ups. But for just kind of the normies, as I affectionately call them, the folks that just have, run-of-the-mill, like sort of average people symptoms, like, cough that won't go away, or occasional headaches, or maybe a little bit of indigestion or something like that, then probably treat more than one thing at once without any major concerns. So I hope that information was useful. If you have any further questions on this topic, please feel free to post it in the comment section below, or if anybody has any questions about any topics related to health, complex chronic illness, whatever it happens to be, I'm happy to try to answer as soon as I can. So I'll leave it there for now.